Welcome to all the attenders of the 8th International Symposium on Focused Ultrasound. I'm really honored to introduce you and present the results from the Italian group for Focused Ultrasound in Neurosciences. These are my disclosures. Anything really relevant at all? We all know that Focused Ultrasound, MR-guided Focused Ultrasound, is an emerging non-invasive technology that is giving us a new therapeutical approach to different diseases. In recent years, neurological application of this technology is starting to really impact the neuroscience field for the treating of a growing number of neurological disorders. And in Italy, in the past years, 5 different clinical centers have invested in this rapidly expanding technology for both clinical care and research. The aim of this work is to present the results of the procedures performed in Italy between Q1 2015 and Q2 2022. We treated patients with AT, PD, but also patients with neuropathic pain that are all the condition included in CE mark of conformity nowadays. But as I will show you in the next slides, we also treated some clinical conditions that are not yet included in the current CE mark. We collected the severity, the number and kind of adverse events, as well as number of aborted or failed procedures. This is not going to be a geography lesson, I promise, but this is just to show you what happened in Italy in the last 8 years. We installed the first system in Palermo, thanks to a key collaboration with the University of Rome La Sapienza. And the site in Palermo has been the world first site integrating the Exablade 4000 with a 1.5 Tesla unit. In 2015, we treated the first patient. And then the colleagues from Verona University Hospital installed the system integrated with a 3T magnet. And then the colleagues from L'Aquila, again with a 3T magnet integrated system. And then 2 more sites, one in the northern part of Italy, the colleagues from the Carlo Besta Institute in Milan, again with a 1.5 Tesla system, and the colleagues from the Bonino Puleio Center in Messina integrated a system again with a 1.5 Tesla unit. So we have 2 sites in the northern part, 1 in the center of Italy, 2 in the southern part, 3 with operating with a 1.5 Tesla unit, and 2 with a 3T scanner. These are our results that we show you better later on with some graphs. As you may see, even if we have been affected by the more than 2 years long COVID-19 pandemic, we treated more than 500 patients to date, and most of them were treated because of tremor with a VIM thalamotomy, a few thalamotomy for neuropathic pain, and pallidotomies for dyskinesia in PD. Most of the treatment we performed were on patients with essential tremor, almost 300, and PD patient, almost 191. We treated also a few patients with dystonic tremor and neuropathic pain and dyskinesia, but other clinical conditions such as vascular tremor, essential tremor in comorbidity with multiple sclerosis, tremor in multiple sclerosis, hemochromatosis associated with Parkinsonism, cerebellar tremor, and spinocerebellar ataxia type 2. These are the results more in details, and once we have no time to comment too much all these results, but consider that for example, most of the adverse events reported were reported by the same patient. So the real percentage of patients with an adverse event is even less than the one calculated for each category of patient that I'm showing you. These are the second part of our results. And as you may see, we had some relapse, less than 4% in patient with ET, a little bit more in patient with PD, and less in patient with dystonic tremor, and definitely a higher number of relapses, more than 22% for other kind of tremors. The total number of aborted or failed procedures was 3.5, so not that much. And we had no severe permanent adverse events reported by our patients and by the neurological visits. And the percentage of patients with mild or moderate adverse events, as I showed you before, were 14.5 in total, but most of those are different conditions. They're reported by the same patient, so the actual number is even lower. But in all the cases, the patient reported no restriction in daily life activities, and this is very important, of course. 6 retreatment after symptom relapse were reported by the sites, and 3 sites performed also staged after at least 6 months from the first procedure, bilateral VIM thalamotomy in 12 patients with essential tremor. I want to show you, before concluding, a few graphs that are giving to you an idea of what happened because of the pandemic. After a very nice growing trend, the pandemic hit us a lot. As you may see, there is a very reduction in the number of procedures performed during and after the pandemic. It's very easy to see in this graphic as most of the patients treated were patients with AT and PD. And if we plot the total number of treatment by year and site, we also see that the southern sites, so the sites from Palermo and Messina, were those more affected by the COVID-19 pandemic if compared to the colleagues from L'Aquila in the center of Italy or in the northern part of Italy, so the colleagues from Milan and from Verona. In conclusion, even if we, of course, had to face some particular years due to the pandemic, and also we have to take into account the physiological learning curve to which all the teams dealing with this emerging technology had to face, our results confirm the high safety profile and the high success rate of focused ultrasound procedure for the treatment of several neurological disorders. And even if we have to consider the influence from the methodological modification of the focused ultrasound neuro procedures over the last few years. So the treatment that we perform nowadays are not the same of those I performed in 2015, for example. Nevertheless, our data confirm the excellent results that we can achieve thanks to a teamwork that in all the Italian centers involves neurosciences with complementary skills such as neurologists, neurosurgeons, neuroradiologists, and also medical physicists. I really want to thank you for your attention, and again, I've been honored to present this data from all these great colleagues from L'Aquila, from Milan, from Messina, from Palermo, of course, from Verona, and also from Rome. And I want to thank you, of course, also the guys from ProMedica Bioelectronics that support us in this very nice meeting that we trust we're going to have also in the future after the stop we had to face because of the pandemic, and we moved from meeting in person to a virtual meeting, as you may understand. Thank you again for your attention.